Today we're going to talk about a medical condition that probably many of you have never heard about. But it's a condition that's serious, especially for kidney patients. It's called hyperkalemia. And in just a few minutes, we're going to sit down with Dr. James Land, nephrologist here at Vancouver General Hospital. And he's going to talk to us about everything you need to know about this condition, including the risks. So don't go away. So thank you so much for being here today, Dr. Land, and welcome to Plugged In.
It's my pleasure to be here today.
So Dr. Land, in a nutshell, what is hyperkalemia?
So very simply, hyperkalemia means that the level of potassium in the blood is too high. Potassium is an electrolyte that everybody needs for the body to function properly. But in the state of hyperkalemia, that person's potassium level is simply too high.
So what would you say some of the common causes are of hyperkalemia?
So it's interesting because potassium is a critical electrolyte that everybody needs. And in a normal circumstance, your body can properly excrete it in the urine. So as much potassium as you take in, you should be able to pee it out. In the normal circumstance, that's the case. But in patients with kidney disease, that's when potassium builds up in the body and that there's an inability for the kidneys to excrete potassium.
So would kidney patients or others, would there be any common symptoms that they would feel?
Most of the time when patients have hyperkalemia, they actually feel no symptoms. In the severe cases, people may feel like their muscles are cramping up, they may become weak, and in severe cases, their heart can actually stop. So what I want to stress here is that unlike many medical conditions in hyperkalemia, many patients actually feel fine whatsoever, unless you do a blood test to confirm that.
And so we talk about, having kidney disease can make you at higher risk for hyperkalemia. Do you have any idea how many kidney patients may actually be at risk or affected by hyperkalemia?
Yeah, so if you look at most studies, depends on the cutoff used to define hyperkalemia, anywhere between 20 to 40% of kidney patients can actually have this condition.
That's pretty high.
That can be very high, yeah.
So how serious is this condition?
So as the potassium level gets progressively higher, symptoms can go from muscle weakness to severe cases where the heart actually doesn't want to pump anymore. And in that case, it's quite severe because essentially that person's heart has just stopped.
And so for people who do have hyperkalemia, what options do they have?
So the mainstay of treatment for hyperkalemia is to change the diet. Most of the potassium comes from foods that we ingest. So naturally, the first step is to look over your dietary plan and see which foods can you eliminate that contains high potassium. If you have gone through this process and your potassium level is still quite high, the next step is to see are there reasons for high potassium in this particular person besides kidney disease. Sometimes medications can cause that. You may want to change some of the medications that one is taking. Once you go through this process, if the potassium is still high, there are medications that one can take to lower the potassium in the system.
Perfect. Well, thank you very much, Dr. Land.
Thank you. My pleasure.
And we're back with Dr. Land, and I've got some great questions from our viewers to ask you.
I'm excited. Fire away.
So Barb from Victoria asks, I have kidney disease. Does that mean I am at increased risk for hyperkalemia?
So Barb, that's an excellent question. When someone has kidney disease, it can range from mild to severe kidney disease. So for stage 4 to 5, as the severity of kidney disease gets worse, that's when the risk for hyperkalemia goes up higher. But for most studies, if you look at them as a whole, most kidney patients, about 20 to 40% of them will have a high risk for hyperkalemia.
So Manpreet from Abbotsford asks, how do I know if I have high potassium?
So Manpreet, the only way to diagnose high potassium is to do a blood test to check the actual potassium level. Most patients with high potassium, they suffer no symptoms. So unless you do a physical blood test, to confirm that, it would be very difficult to diagnose it.
That's great information. Stefan from Quesnel, how do I follow a low potassium diet?
So Stefan, the best way is to consult with your local dietitian. We all have printouts on which foods contain high potassium. They're definitely the ones to avoid. If it's difficult for you to access a local dietitian, The Ministry of Health actually has a number 811 that one can call between 9 to 5, Mondays to Fridays, and there you can get access to a registered dietitian and they can help you with deciphering which foods may or may not be okay when it comes to potassium.
Okay, I'm interested in what you've got to say about this, Dr. Land. Pauline from Kelowna, she says that she's heard you can take potassium out of high potassium vegetables like potatoes. Is this true?
That is very much true, Pauline. So when you cook potatoes, there are a couple ways to do it. One easy way is to soak your potatoes in water for over 2 hours. That will allow the potassium to be leached out of potatoes. Then you can go ahead and cook them.
Wow, learn something new every day. Great. Ruth from Smithers. My husband was just diagnosed with very high levels of potassium in his blood, which his doctor has explained to him is hyperkalemia. Should I be worried? How serious is hyperkalemia?
So Ruth, hyperkalemia can be serious if the level of potassium is too high. What I would suggest to you is to consult with your husband's physician to find out the level of the potassium to see if it's critically high or borderline high. If it's high, there are many ways one can treat hyperkalemia, ranging from changing one's diet to taking medications to actually lower the potassium in the system.
Great. And finally, John from Burnaby. He says, I've just been diagnosed with hyperkalemia. What are my options for treatment?
So John, the easiest option is to change one's diet because most of the time that is sufficient to lower the potassium into the safe range. If that doesn't work or it doesn't do enough of a good job to lower the potassium, the next step is to find out other medications that cause hyperkalemia that one's taken that can be removed. If that doesn't do the trick, the next step is to take actual medications that lower potassium. Most people don't like taking those medications because they don't taste very good. So we would try offering an option to change the diet first before jumping to the medication.
Wonderful. Well, thank you very much for your time today, Dr. Land.
It's my pleasure.